Good evening, friends, family, brothers, sisters, our faithful followers of the second district. My name is Kelvin Ampofo. I am the immediate past. That's right. The brothers know it. No pass like immediate pass. The immediate past district representative of the mighty second district. And it is a pleasure. It is an honor to come before you again this last Wednesday of June as we continue to make sure our community is uplifted as it relates to medical and health awareness. I certainly want to salute our grand bossless, Brother Ricky Lewis, who leads this fraternity. And certainly we want to give a shout out. We want to acknowledge our leader, our current second district representative, Brother Del Rico Gales, and all that he does. Well, certainly, let's get into it. Hopefully by now, you know the dynamic doctors that we have serving this mighty second district and this esteemed panel that we have with us on tonight. As always, we're going to go in order. And as we always say, the things that you hear tonight are opinions of the doctors themselves. Does not necessarily represent the views of the Omega Psi Phi Fraternity or any entities or organizations that our doctors may be affiliated with. So with that said, as we are still celebrating Juneteenth, you see, got my little, Wakanda forever, all that good stuff. Dr. Boykin, we call him 78. Dr. Boykin, hopefully all is well with you. Good brother. Go ahead and introduce yourself in case we got some people joining us for the first time. It's good to see you. I miss you, my brother.
I missed you too. It's good to have you back, brother.
Good
Good
to be
evening,
here.
folks, and welcome to our second district health and wellness monthly webinar. And I certainly want to thank everyone for being so faithful, as Brother Ampofo said, and coming to see us and hear us every month. For those of you who may not know me, I am a retired pediatrician, but I'm also trained in internal medicine. I did one of those dual residencies in internal medicine and pediatrics. So I have some depth of knowledge in the adult world as well. I practiced for over 22, my last 22 years in pediatrics only though. And I was very, very adamant about educating our general community about the COVID effort. So I'm not going to say a whole lot about that. I just want to say welcome, you guys. We have an interesting topic tonight, and one that you don't think would affect pediatrics, but we'll see, hopefully, as the night goes on, that it does. So I'm going to yield to our second district health and wellness chairman, Dr. Phillips.
All right, that sounds good. We call him 88. I didn't know if Dr. Phillips was on tonight. There he is, 88.
78. We need to get 98 straight again.
He wasn't on the roll call. He wasn't on the roll call. Ladies and gentlemen, our chairman of the second district health and wellness committee, none other than the doctor who's been with us since day one. We're talking about when this pandemic first started. This brother and him and the rest of his colleagues, the four horsemen, since day one, making sure that the communities knew what was going on. He was at the epicenter. He was there from the beginning and has been with us since day one, continues to lead this district, this health wellness committee, Dr. Jedan Phillips, 88. Good evening, my brother.
Well, it's great to be here. It's good to see everyone. Again, we are here yet again, trying to put out preventive health information to try to help us, be the healthiest community that we can be. Tonight, we're going to be talking about stroke and stroke risk. Stroke is a problem that is very common in our community, and unfortunately, it's associated with a lot of risk factors that run rampant in our community as well. So again, I'm looking forward to the conversation with my colleagues, and I hope this continues to be informative information for individuals to help them make the best choices about their health care.
Outstanding. As always, Dr. Phillips, we appreciate you. Let's go ahead and introduce the rest of the team, the rest of the panel that's going to be on with us tonight. We call him 95, Dr. Lee Isabell, also serving in the New York area. Dr. Isabell, good evening to you, my good brother. Say hello to the folks tonight.
Good evening. Glad to be here again. I will get my input. I'm board certified internal medicine, and I'll give my input on regarding stroke, and then if we have time, maybe a little Alzheimer's disease, which has affected a lot of people in the Black community also. Thank you.
Sounds good, Dr. Isabel. As always, we appreciate you and all that you do. Let's take it to the next year, 9-6. Dr. Plummer, you know, we always have to represent for the ladies. So Dr. Plummer is here, making sure that the ladies are taken care of. Dr. Plummer, it's good to see you, team.
Hi, good evening, everybody. Glad to be back. My name is Dr. Christopher Plummer. I'm board certified in obstetrics and gynecology and also specialize in high-risk pregnancies. And it's called maternal fetal medicine. I'm glad to talk to everybody about stroke. Women are not immune from stroke, and we'll talk about the increased risk of women having stroke and also especially in pregnancy. All right, glad to be back.
Looking forward to the discussion, Dr. Plummer. And what we have here is we've got 78, we've got 88, we've got 98, and now we've got 08. Dr. Ford, we always talk about the importance of making sure you get your checkups and going to see your doctor. So, Dr. Ford, it's good to see you. Good evening. Say hello to the people tonight.
All right. Good seeing you, brothers. My name is Dr. Kelvin Ford, and I'm a board-certified internal medicine physician practicing here in Prince George's County, Maryland. And definitely this is a very important topic, as we know it runs rampant in our community and also hits home for a lot of us, including me. So looking forward to the discussion this evening.
Sounds amazing. Sounds amazing. Well, with that being said, Dr. Boykin, I mean, the topic for tonight. I mean, we're talking about stroke. We're talking about, how about we just start off with just a simple definition? Let's explain to people what a stroke is, and then let's go from there. What is a stroke? People hear the term, but let's make sure we understand exactly what a stroke is. Dr. Boykin.
Well, I appreciate that, but I think I'm going to turn that over to Brother Dr. Ford so he can give a little bit more in depth, and I'm going to let him lead that because the difference between adult and pediatric strokes are significant, but they're very similar at the same time. So because the pediatric world has a different little spin on stroke, I'm going to defer to Dr. Ford to give us the adult presentation. We see more adult type strokes than we see in pediatrics. So I'm going to defer to him, Brother Ampofo.
That sounds good, because you know how we do. We start with 78. We make sure, no problem. So Dr. Ford,
yes, sir.
The floor is yours.
Sir. All right. Thank you. So when you talk about stroke is when it's a couple of different types of strokes. You have something called an ischemic stroke, and basically that's when the blood vessel that goes to your brain gets blocked. And when the blood vessel gets blocked, the brain tissue gets it dies. Okay, and so when it dies, what happens is that the brain sends different. It's our epicenter. It sends out signals to all parts of your body. So that part of the brain that actually dies, then you're going to have symptoms from that. Okay. And I'll get a little bit more into symptoms in a minute. There's also what we call a hemorrhagic stroke. And that's when that blood vessel actually bursts. So if you look at a water hose or a balloon or something like that that's filled with fluid, if that it gets a bubble and it bursts, then you're not going to get blood to that part of the brain. And so that will cause some of the same symptoms that the ischemic stroke, which I just talked about, has. And there's also a precursor to stroke, what we call a transient ischemic attack, or TIA. And basically that occurs when you have some blockage of a blood vessel going to the brain or in the brain, and you get symptoms of a stroke, but it only lasts for it resolves within 24 hours. And it's important if you have that TIA, because we know that's a precursor for possibly having a stroke later on. And so it's important to do your due diligence as physicians to work up a patient to figure out why they just had that TIA. And so when you're talking about, symptoms, things that you're looking for, if you are having symptoms, or if you're in a room and your loved one is having symptoms, you're looking to find out, see if they're all of a sudden they seem confused or dizzy or have a sudden headache, or, you know, one of the things that we talk about is also, it's called FAST. Okay. And so FAST, meaning if you're suspecting someone has a stroke, you need to act fast. And that F for fast means you want to look at that person's face and to see whether they're able to make a smile or they have any kind of drooping of the face. You want to make sure that also the A is for says arm. The C could be arm. Really, it could even be their legs. Do they have any weakness of one extremity, one side of either the right or left side? The other is speech. Is talking about slurred speech or speech seems mumbled. If any of those things are occurring, then that means when you talk about time, you need to call 911. And 911 is so important. The faster you get treatment for someone, the better off that they're going to be. So I think I kind of explained that. I know we have a lot of brothers on here, and they can chime in to fill in some of the more details.
I just want to just add a little bit to it, because this is where the pediatric part comes in, Brother Ampofo and Brother Ford. You know, FAST is the mnemonic we use for stroke, but we put 2 other letters in front of that in the pediatric where we call B fast, because we may see kids may have, initially present with stroke, just balance problems. They may just all of a sudden have balance problems, and you know, you wouldn't think normally that a child with balance problem that we might be having a stroke, but something to think about. And the other thing is their eyes. Are their eyes deviate? Now, their eyes have some type of difference, you know, out of norm for them. So I just want to add that little part on there to the FAST. B fast in pediatrics is significant, as well as the FAST in the adult world.
And I would also add that, again, you know, as Dr. Ford mentioned, the timing that you get into the hospital is critical. You know, too many times with TIA or stroke-like symptoms, you see people say, well, I thought I was going to just wait it out and see if it went away. That critical time period could be you being back to your regular self versus you having a deficit was, you know, for the rest of your life. So again, you know, when they say fast, it's not just looking at the symptoms, it's also the reaction to the symptoms, because the quicker that you can get into the emergency room if you're having an active stroke, and usually that time is, they want to have you in the door and evaluated, you know, within 3 hours of the onset of symptoms, which means within 3 hours of you beginning to feel weird. That is the time period that you need to get yourself into the emergency room, and preferably you would like to go to an emergency room, a hospital center that has stroke services, because unfortunately, if you're not able to get to one of them, you may not be able to have some of the treatments that are capable of reversing the situation.
And it's also important when you call 911 that the appropriate, you know, ambulance comes and takes you to the appropriate hospital and notifies the stroke team that they're prepared. So when you actually get to the hospital, they can start to evaluate you. That will save on time and save on brain injury.
Now, an interesting thing when you talk about stroke, because it's a heart attack of the brain in a sense, you know, is how preventable it can be. And a lot of times you've got people walking around with problems that they're not addressing. And unfortunately, those problems such as high blood pressure, problems such as elevated cholesterol, that's poorly controlled, problems such as type 2 diabetes. You know, those are a few medical conditions that can directly lead to stroke development. So staying on top of those conditions, which unfortunately what we saw during the pandemic was the fact that in those particular conditions that I just mentioned, African Americans tend to do the worst as far as how the state that they are dealing with.
And that was associated with a higher incidence of strokes during the COVID pandemic, as Dr. Phillips also said. Brother Colonel Bracy's asks, strokes only associated with the brain? Primarily, yes, because we call it cerebral vascular accident, meaning brain vascular, brain blood vessels. So I just want to answer that question before we move on to the next topic. Next segment. Sorry.
After seeing this,
It looked like Dr. Isabell. Maybe did you want to chime in on something, Dr. Isabell?
Yes, I want to chime in regarding strokes. Blood flow. We need oxygen. We can't live without oxygen. The blood carries oxygen to the brain, and then that's when the brain cells do not get oxygen. That's where we have a stroke. The stroke is high in the African American community, men and women. Women are strokes. It's the 5th leading cause of death, as from the CDC. 1 in 5 women between the ages of 55 to 75, they said, will have a stroke. While they say African American men, they are high risk because a lot of times they may not know that they have high blood pressure. They have diabetes. And so to add to strokes, we talked about fast. So I'm going to add our ABCs. As soon as a stroke is identified, we think of they just like sometimes heart disease, you can take aspirin. Well, depending on if you cleared or blood pressure control, but with a stroke, at times you see the blood pressure may be high, but the doctors don't always want to correct it too fast because the low perfusion can actually make the stroke worse. So if for example, your blood pressure may be 180, they higher than that, that's when they may bring it down, but they may not want to initially normalize it. Usually that anyone that has a stroke, it's all protocols. Hospital, you put somebody on a cholesterol lowering medication even before you know the results of their cholesterol. Other things that can help, if you smoking cessations. So, and healthy lifestyle changes. Thank you.
And just to chime in on what Dr. Isabell was talking about, even young women are increased risk of having a stroke too, especially when they're pregnant due to severe preeclampsia, which is elevated blood pressure. And sometimes their blood pressure becomes so high that they can develop a hemorrhagic stroke. Also, women that are birth control pills and smoke, they're in an increased risk of developing a clot and having an embolotic stroke. And also women that have migraines, severe migraines with an aura, they're also in an increased risk of developing a stroke. And people that have sickle cell disease. Now, sickle cell people are now becoming pregnant now, so they're also in an increased risk of the sickle blocking the artery to the brain, and that also can cause a stroke too. And as I said again, strokes are probably 4 out of 5 are preventable with good lifestyle changes. Stop smoking, get your cholesterol under control, know your blood pressure, and those things, those factors it's always been prevention that we've always been talking about. So that can also reduce the risk of a stroke.
I want to chime in on that real quickly because Dr. Plummer brings up an interesting topic that we see in the pediatric world, and you have to be aware of it. He talked about sickle cell disease. I think the youngest, well, at the time when I was probably a medical student, I remember my first pediatric stroke was a 12-year-old sickle cell patient that had a stroke with, she had hemiparesis as a result of that. So an interesting fact for sickle cell patients that 39% of all sickle cell patients will have thought by the time they will have had a stroke by the time they reach the age of 18 years old. That's 39% of all pediatric sickle cell patients. And the thing about stroke and sickle cell patients, they might be silent strokes. They might not have any outward appearance when you first see them. So that's why it's important to get good care, as all my brothers have talked about, if you have a sickle cell child or sickle cell adult, because you may be, sickle cell disease is vaso-occlusive, mean blocking, and therefore giving you ischemia. So it's very, very important to know about sickle cell and your family history, particularly if you have a family history of berry aneurysms, or aneurysms, another cause of what Dr. Ford talked about, hemorrhagic strokes. When they were suddenly rupture, they may not, give sudden death as some people have, but they may cause some stroke-like symptoms. So I just wanted to chime in on Dr. Plummer. Very, very important aspect of sickle cell disease is prevention of vaso-occlusive strokes in those patients.
That's very, very, very critical. And let me just, before Dr. Ford, before we move on, between Dr. Boykin and Dr. Plummer, we're talking about sickle cell. Can you just clarify? Are we talking about the full blown out sickle cell, or just even if you have the trait?
Not so much the trait, but you have to have any of the sickle cell disorders that cause vaso-occlusive phenomenon, vaso-occlusive crisis. So it could be sickle cell thalassemia, what we call sick thal, full sickle cell anemia, but not the trait.
Very good, very good. Dr. Ford, before we move on to the next thing, if you could, obviously we've had several people join. Can you just quickly, we were talking about strokes, can you give people just real quick some symptoms, obviously, and if they see these symptoms, what they should do in the event they see someone with these symptoms of a stroke?
Sure. And so some of the symptoms that patients can get, they can feel dizzy, they can have a sudden headache, slurred speech, weakness of an extremity, whether it's the arm or leg, and usually it's one side, balance issues, right? So those are all things. And we talked about also fast and acting fast, right? And so fast meaning you look at the face, see whether the patient can smile, do they have any asymmetry in their smile? You're looking at their arms, I mentioned, as far as fast, the A, as far as raising your arm, or do they have weakness on one side more than the other? And I talked about speech, slurred speech, not being able to communicate properly, or not being able to communicate at all, right? So those are some of the symptoms that patients have. But also we were talking about risk factors for stroke. Another important one, patients that have heart disease, called atrial fibrillation, okay? And atrial fibrillation is when your heart rhythm is beating irregularly and irregular, right? And so what happens is it starts to beat irregular, and it throws, you get a clot that's thrown off from the heart, can go through the blood vessels and go up to the brain and cause a stroke. And so that's a very important, if you're feeling any fluttering or dizziness or anything like that that's abnormal, you need to really get that checked out, okay? And that's very important. Another one too that really isn't talked about a lot, people that have severe sleep apnea, okay? Severe sleep apnea. And a lot of times they have decreased, if they're snoring and have this, what we call apnea, it means that you're not breathing for long periods of time, right? And then when that happens, you can possibly even get a stroke, decreased oxygen, Brother Isabell talked about. So that's something that it's not as common, but that's something that can happen. And so, if you have a partner or a friend, they're snoring to death and you hear them just, stop breathing, that's something you really want to encourage them to get checked out, because they won't know it. Most of the time they don't know it. But the atrial fibrillation, that's something that can happen to a lot of patients and needs to be addressed.
To add to Dr. Ford regarding strokes, he mentioned atrial fibrillation. That's why it's important to take your blood thinners, because missing your blood thinners increases your risk of having a stroke. Missing 1 or 2 days, it could be a lifetime change that could be permanent. Other less common things we forget about: illicit drugs and alcohol, particular cocaine. cocaine causes restrictions of blood vessels, and which affects the blood supply. So you can have a healthy person, no problem, and you think you sniff a little cocaine, and that could be your last. You could either have a heart attack, or you could have a major stroke, or even seizures, which can lead to a stroke. We forget about sometimes seizures can cause, going into that, can cause the lack of blood flow. You can go unconscious and you can stop breathing, and you can have a secondary stroke from that also. These are some of the other things. Thank you.
Who was next there? We got all these, fantastic doctors and again, our friends, our family who's joining us. Again, at the end of every month, our doctors right here from the 2nd District of Omega Psi Phi, they do this voluntarily, making sure that we have the latest, the greatest, the most up-to-date information as it relates to our health. And certainly, as always, we want to thank them. We're talking about stroke awareness, stroke prevention. That's the topic of tonight. Dr. Ford, we'll go back to you.
So I guess the important thing too is, we talked about the risk factors for stroke. One, you have to come to the doctors, right? And prevention, Brother Phillips always says an ounce of prevention, right, will help prevent a lot of major problems. So it's important to come to the doctor, get your blood pressure checked every month, not every month, excuse me, at least once a year. Get your blood pressure checked. If you have high cholesterol, making sure that you're taking your medicine to try to prevent those arteries from clogging up. If you're diabetic, get your diabetes under control. So many different, just bottom line is go to your physician, your primary, get checked out, and make sure you get screened for all the things that can cause you to have a stroke.
So let's add to that the risk factors in the pediatric world, because I think a lot of people tend not to pay attention to that. And heart disease is probably the number one cause of strokes in pediatric world. And strokes are in the top 10 leading cause of death in pediatric population, believe it or not. Okay. Most of the problems, the issues with the blood vessels, you need to know your family history. We have talked about this so many times on these talks of family history. As I already mentioned earlier, if you have a family history of aneurysms of the brain, we call them berry aneurysms, and your child may have aneurysms in his or her head. There's another thing called AV malformations, or arterial venous malformations. There are certain congenital brain disorders that would have those, like Arnold-Chiari malformation, and those kids have 4 different types of those things. That's not important. The important thing is that those things can lead to strokes in and of itself. Congenital heart disease can lead to it. Other clotting disorders. There are some children that are born with congenital clotting disorders, and as Dr. Isabell talked about, if you don't do the right not every child is on blood thinners, but more and more evidence suggests that some children may need to be on blood thinners at some point in time in their life. And if they're not, they may be at risk for stroke. Sickle cell disease we already talked about. And the most high risk factor, if it's not related to heart, the illicit drug use in our adolescents, and diabetes, smoking, and drinking can lead to risk factors in the pediatric world. So I just want to add that little twist on what we've already talked about here, that people need to be aware of their children. If you have a teenager that's smoking and drinking a lot, they could be at risk, particularly if there's a family history of heart disease or a family history of diabetes, and they may not be undiagnosed, because a lot of teenagers can be diagnosed with, guess what, type 2 diabetes in the pediatric world. So those are some of the risk factors from the pediatric standpoint.
I would just like to add, and underline what Dr. Ford said, because so many times, even with risk factors, the biggest thing that I see is I didn't take my medication. And that is something that is critical, because we talked about many times how hypertension is a silent killer. And this is one of the ways that it will kill you. I meet people that have had strokes, and I ask them, did you have high blood pressure? Yeah. Were you taking your medicine? Nah, I wasn't taking it like I was supposed to. And that right there can put you over the edge. Another thing, when we talk about atrial fibrillation, the blood thinners. You've got blood thinners that require weekly blood tests. But now you have newer blood thinners that don't require the blood testing. And sometimes when you are on a blood thinner and you have to get your blood tested on a regular basis, that can be a deterrent to people taking it on a regular as they should. So again, exploring these options with your doctor is important, because there may be some medications, if you need a blood thinner, that don't require you to take to have a blood test done regularly. Lastly, I would just say this: how many of us have joked around about somebody that snores a lot? Damn, dog is chopping wood right there. Whatever we might say, we've been on a road trip, and I remember in my house where I grew up, my father snored. You could hear him 2 floors down. He ended up dying of complications of heart disease. Obstructive sleep apnea can cause fatigue that is relentless, no matter how much you feel you sleep, but also it can affect your heart and lungs in a very deleterious way. So I just wanted to mention those things, because sometimes I don't think they are appreciated for how serious they are.
Let me address the question again from my brother, Colonel Bracy. Are strokes hereditary? I guess I have to say this as being a pediatrician. Not really. They tend to run in families, but they may be essentially hereditary if you have the hereditary risk factors for them, like hypertension or certain things like that. But strokes in and of themselves, as far as I know, and brothers, please correct me if I'm wrong, as far as I know, are not hereditary, but they tend to run in families if you have the inheritable risk factors for stroke.
Dr. Isabell, sorry.
No, I was just also saying that also with uncontrolled lupus can also increase the risk of stroke. If you're pregnant and you have what we call, if your blood has a tendency to clot during pregnancy, has a tendency to clot even 5-fold. So if you're not taking your blood thinners or you're not keeping control of your lupus, then that also will increase your risk of developing a stroke.
To add what Dr. Plummer say regarding lupus, regarding also hereditary, it could be indirectly. For example, if you have antiphospholipid syndrome, that can lead to a stroke as well as blood clots anywhere else. So that is hereditary, which can put a risk of stroke. And that's why important if the person be on blood thinners. Also, indirectly, it could be, for example, if someone has a polycystic kidney disease, where they have a lot of cysts of their kidneys, which is usually hereditary, that indirectly could put them at a risk of a brain aneurysm, which can cause a hemorrhagic stroke. So indirectly, there are some things that may be hereditary in that aspect.
So I failed to mention, and please forgive me, blame it on my head, not my heart. I failed to mention there is a hereditary disease that is a high risk for stroke, and that is sickle cell. And sickle cell is an inheritable disease, and as I said previously, 39% of all people for the true sickle cell patients may have a stroke before they reach the age of 18. So that's the only inherited high-risk disease that I know of for stroke, other than the things that my brother's already talked about here. And of course, any other congenital malformation, any other congenital heart disease may be risk. But other than that, that's probably the major ones I can think of in the pediatric world, at least.
So my fellow doctors, my fellow brothers, so just a question, because remember, we're here uplifting our community. There's some that they don't have the medical knowledge. And so one question that I just received was, I thought a stroke and a heart attack were the same thing. Now, obviously we know that they're different, but can we just, somebody clarify the difference? What actually happens when we have a heart attack versus a stroke?
Well, the similarity in the two processes is that there is a disruption of blood flow to an area of the brain, just like there is a disruption of blood flow to the heart. In the heart, when you have a heart attack, the area that is involved could jeopardize the functionality of the heart moving forward, which could cause bigger problems. In a stroke, the area of the brain that is impacted may involve your speech, may involve your coordination. Depending on where the area that's impacted, that dictates the type of deficit or symptom that you may have. The causes of it, as it was stated earlier, could be multifactorial. It could be illicit substances. It could be clotting or disorder. It could be a thrombotic disorder where you are developing clots that block the blood vessel. It could also be related to conditions like high cholesterol. It could also be related to having too high of a pressure pushing blood through, which could cause a problem, a hemorrhagic stroke, or a rupturing of blood vessels. So again, in a big picture sense, the interruption or disturbance of blood flow to a particular area of the brain or heart, that's where the similarity lies. However, the process that leads to that could be different in as far as what happens in a stroke.
And brothers, the blood vessels, there's no real distinct, I mean, it just depends on where the blood vessel is going that we determine what's going on. And I guess if Brother Wingfield was here, he does vascular. We were even talking about peripheral vascular disease is a big problem, right? So when we talk about peripheral vascular, meaning the blood vessels in the legs can get clogged, right? And that can lead to patients getting ulcerations of the toes or the leg, and then also amputation, right? So that's the more serious thing for if you have what we call peripheral. That means that's not the brain. The brain is going to be a stroke. If it happens in the heart, you're going to have a heart attack or MI, myocardial infarction. If it happens in the leg, then we call it peripheral vascular disease. So it's all one big blood vessel, right? It just depends on where it is. Do we decide that what we're calling it? So that's what I think.
Yeah, I wonder, because I know it's a topic, and I saw the question from my good brother, 84 pod chapter, asking a question about snoring. And so I just wonder, I certainly don't want to, change his words, but I wonder, his question basically was, what can be done with, somebody that snores a lot. I mean, obviously, I'm no doctor, but I understand that there's, sleep studies and things like that. But I wonder if he meant, or if I could try to add on to it, at what stage is too much snoring to where you need to seek medical advice? I guess, is snoring, normal to some extent, or at what point does the snoring need to be looked at by a doctor?
Well, I think if you start seeing someone stop breathing, and those are called apneic episodes where you sort of stop breathing, because that is what they look at when you do a sleep study. How many times do you stop breathing in an hour? And based on that number, and it could be over 100 times in an hour that somebody stops breathing, what that does basically is it disturbs the quality of your sleep. Our goal when we sleep is we want to get into REM sleep. REM sleep speaks of a depth of sleep. And at that point, that's when our bodies are able to rejuvenate and replenish. The analogy that I would use is, say you plug your phone in, and normally it takes an hour for your phone to get fully charged. If you plugged your phone in and you had sleep apnea, in that same hour, you might get a 50% charge. And the problem with sleep apnea, it's more of a gradual situation. The symptoms start to worsen over time. It can lead to weight gain. And again, when we talk about weight gain, there's an abundance of things, heart disease, diabetes, that are affected by that. So it's kind of a base situation that has a lot of spillover that can be extremely dangerous. And like I said earlier, a lot of times we got jokes about snoring. And I think because we traditionally have jokes about it, I think sometimes it's kind of hard for people to understand the seriousness of it. So say you're a person who's been diagnosed with type 2 diabetes, you're overweight. They say, hey, you need to lose weight. You're going to feel like you're running uphill on a slippery slope when you have sleep apnea and that's not in control, because you can do all the right things, but then you're going to feel tired, which may prevent you from doing those lifestyle changes. And then what you see is it's a lot harder to lose weight in spite of your efforts with a person that has poorly controlled sleep apnea.
Dr. Plummer, as always, we always making sure we take care of our ladies as well. On this topic, we've been referencing indirectly the fellas, if you will. Anything for the ladies related to sleep apnea and their health?
Well, I mean, sleep apnea, as they mentioned before, is still a problem. They usually get it diagnosed with a sleep study. Then they try what we call a CPAP, which is a continuous pressure device that tries to keep their airway open as they sleep. Some people don't tolerate a CPAP machine. There's been other interventions that are going. You've probably seen Aspire. What they do is they put like a little device around in the neck, around in the tongue area, and it stimulates that so their tongue doesn't fall back in the mouth, in the roof of the mouth, and block the airway. And those are for some people that are unable to tolerate a CPAP machine. So there are some other mechanisms that are out there. Some use mouth devices that are able to push their tongue out of the way, because that's usually causes the obstruction and blocks the airway. And after a while, when you become apneic, just like if you're drowning, you just wake up because you can't breathe, and then that disturbs your REM sleep. And if you do that, sometimes you might do it and not even know it. Constantly over and over again, you don't get the adequate sleep that you get. Pregnant women are also susceptible to that if they already have issues of sleep, of obstructive sleep apnea. So it also can worsen because the baby's pushing up more on the diaphragm, and they're also getting larger because of the weight of the pregnancy can also cause that issue too.
Another thing I would add to it is now with sleep centers, you are able to do remote testing, because I know a lot of people have a lot of resistance and hesitancy about going and sleeping someplace else. Now, for those, some locations have what they can do a sleep study, but you can do it at your home, which may make it easier for you to get to sleep. Another point I would bring up is if the first mask doesn't work, contact your doctor and let them know that so they can try another type of mask. There are a variety of mask types, and just because one may not work, there may be some other ones. Some are face masks that cover the nose and mouth. Some are just nasal prongs, which just go in the nose. But again, there is also, you can get another one if the first one doesn't work. I think the other thing that's important is sometimes when we lose weight, or maybe if we gain weight, you may need to get another sleep study to get your CPAP unit. If you're on a CPAP unit, get it recalibrated. Because if it's not set at the right appropriate settings, then it's not going to be able to do the job it's supposed to do.
To briefly,
go. I yield to my 95.
To briefly answer the question regarding snoring a lot, you can see an ear, nose, throat specialist also, because is it a deviated septum? Do they have enlarged tonsil, or the thing that we call the uvula that hangs down the throat? Is that large? And sometimes you can have certain surgical procedures that can help lessen the snoring. Or do you have enlarged thyroid, a lot of nodules, or goiter that can cause snoring? And if you had a surgical procedure, or if your thyroid problem was treated, that may help. That's just other examples. Sorry, I yield. Thank you.
Dr. Ford?
No, I think you guys hit it on the head, especially the weight loss. Okay. I mean, that's so important. We have patients that, have lost maybe 20 pounds, 30 pounds, and then all of a sudden they don't need their CPAP machine. The wife says, "Hey man, I'm not even snoring anymore." So, getting closer to your ideal body weight is so important in trying to, treat, sleep apnea. And Dr. Isabell mentioned surgery, which I think that's the last option, but it is an option, right? For someone that has, especially when you have patients who are severely overweight, they're diabetic, they have severe sleep apnea. These are all things that actually can be cured by other surgical procedures, not just for your sleep apnea, but even when people had gastric bypass surgery, that actually cured diabetes and also patients that had severe sleep apnea. I mean, those are last resorts, but they are options for people that are really struggling. I guess right now too, with everybody on the injectable weight loss medications right now, which are helping patients, but those are just options.
Okay. So we've been talking about strokes. We've been talking about stroke prevention. We've been talking about stroke awareness. These are the brothers, the doctors from the 2nd District of Omega Psi Phi. And we come to you at the end of every month, the last Wednesday of every month. These doctors take their time to make sure that the community is made aware of anything related to health. And this month, we're talking about stroke awareness. Dr. Boykin, let me go over to you to see if there's anything else we need to cover.
Well, I think I just want to end up with the pediatric. I want to give a couple of interesting things. I'm not sure if Dr. Plummer sees this a lot, but did you know that 1 out of 4,000 neonates have strokes, and 1 out of 2,000 children older than 2 may have strokes? So that's another important thing to keep in mind. But we've been talking about strokes, and we talked about prevention, as Brother Ampofo said. And I think Dr. Isabell mentioned early in when we first came on, there's another high topic this month that we have been thinking about discussing too. So, and that's Alzheimer's disease. I think a lot of us have been severely impacted by Alzheimer's disease, I think within our own families and things like that. So I don't know, brothers, we want to mention a few things about Alzheimer's disease at this particular point, because it could be somewhat related to dementia from stroke versus dementia from Alzheimer's disease. So I don't know if we want to go there or not, brothers.
Well, I think when you talk about Alzheimer's dementia, I think it's not only a medical issue, it's also a social issue because of how significant these symptoms are and how it impacts individuals and families. So again, I think, being plugged in with your primary care doctor is critical, because not only can it help you with the diagnosis of it, but in the earlier phases, there are some treatments that may be available to slow down the progress of it. In addition to that, when you think about caring for a person with Alzheimer's, the other big thing is taking care or, supporting the caretakers. And what you see a lot of times, for us of a certain age, we remember The Sopranos. And you remember Tony Soprano was about to kill Uncle Junior because Uncle Junior was acting wild, and he was about to do the deed and kill his uncle. But then at the last minute, he recognized that his uncle had Alzheimer's disease. And I think sometimes when we recognize the type of behavioral changes that may occur, we are better able to manage, help, support our own family members that may be dealing with the affliction, because some of the things that can happen with Alzheimer's can be behavioral changes. You could have a person who's probably been the cleanest, most together person all their life. They get Alzheimer's, now they're walking around like a straight hobo in the street. And to a family member, that could be kind of traumatic to see, or a person that may be living, by themselves. And now as this is progressing, they're not able to take care of their own personal needs, cooking, cleaning, self-care. So I think it's important to coordinate with your family doctor or the doctor that is coordinating the situation. But I think also there are other things that get involved with it, such as, educating people about the process, such as making sure that the families, the patient are aware and are obtaining any resources that their insurance may cover for them. Home nursing, a home aid, going to a day program. All of these types of activities can be supported by insurance, but you don't know and you don't take advantage of them, and the situation can really burn a person out.
This is, as my brothers, truly phenomenal information. If we could, just because I know that there's some, and if there's not, then you can say it's me. Let's just make sure we understand, right? We say Alzheimer's, we say dementia. Let's just make sure, can we get a definition? Can we get an explanation of what's actually occurring what does that mean? We hear it all the time, but just so we have an even starting plane on what it is, what's happening, and then if possible, is there prevention that we can talk about? And Dr. Phillips, that was excellent. You talked about things that people can do as far as care and people that are providing care. So can we start out with a definition, dementia and Alzheimer's, and then if there is such a thing, prevention?
I mean, I will just discuss on a personal note. I had two parents that had dementia, and it is very stressful on the caregivers, and also there's an increased risk of elder abuse with sometimes with people that have dementia, because a lot of the caregivers or people that take care of it don't really understand the process, and they take out all the frustration out on the actual person. I don't really see that much in my practice because I deal with a lot of younger people and I deal with fetuses. So I'll defer to my internal medicine colleagues to define it more in more depth.
What I would say in just a general sense, you look at arthritis, which is wear and tear in your joints. Dementia is like a wear and tear, an arthritis on your brain. And as that wear and tear starts to progress, it can affect things like your mood. It could affect things like your memory. It could affect things like your behavior. The difference between regular senile dementia and more aggressive forms of dementia is that the more aggressive forms like Alzheimer's disease, they are on a much more aggressive course, meaning you're going to see symptoms that progress, and they're going to progress a lot faster than you would see with just senile dementia. And as it progresses, you really start to see some pretty significant changes in the behavior of the person. It could start with them just being extremely aggressive. I remember my grandmother had Alzheimer's disease, and she was, in the beginning, she would curse you out. And this was a person that was never her forte at all in our lives. As it progressed past that, you started to see her inability to do basic functions, move around, talk, ambulate, eat, or have an appetite. And then unfortunately, as those symptoms worsen, the not able to take care of yourself starts to take a toll on you and can lead to other more significant situations that could bring you into a situation where you have your ultimate demise. So again, when you look at regular senile dementia versus things like Alzheimer's dementia, frontal lobe dementia, which are much more aggressive. And when I say aggressive, the time that they start to begin symptoms and develop and progress is a lot faster.
So that was excellent. But I think when you were saying too, and just the clarification, dementia is just a broader term, and Alzheimer's is just a type of dementia because there's multiple types of dementia. We just finished 45 minutes talking about strokes. We know people that have multiple small strokes are at risk for developing dementia, right? And dementia is really memory loss and loss of judgment. And so that's what we're talking about. And then, like I said, there's some, like the Alzheimer's, it's a gradual process, whereas some of the other ones that Dr. Phillips talked about, frontal lobe or Lewy bodies, all of those are more aggressive, and where you may lose your memory a little more quickly. And so they're all under the broad term of dementia, but you have different types. And Alzheimer's is the most common type of dementia, memory loss, poor judgment.
This is phenomenal. This is phenomenal. This is powerful information. As always, every time we do this, the same thing happens. We get talking and you all do such a wonderful job of providing this information. And then we always get to this point where we run out of time. So we're going to go to closing comments. We're going to start off with Dr. Ford. 1 minute or less. Your closing comments, your remarks, your takeaways that you want people to have from our show this evening. Dr. Ford.
Well, thank you. I thought this was great information. just want to make sure that everyone realizes that time is of the essence. If you feel that you're having a stroke or your loved one is having a stroke, to assess them quickly. And if you find that or if there's any question that they're having a stroke, get them to the emergency room, call 911 as soon as possible. Also make sure that you're going to your physician regularly to try to minimize risk factors that can possibly cause stroke. And thanks again. We had a great discussion this evening.
Dr. Ford, as always, thank you so much. We appreciate you. Let's go to Dr. Plummer, always representing for the ladies. Dr. Plummer, your closing remarks.
All right, thanks. It's great talk. I learn something every day. Every session I learn something new. The best thing to talk when we talk about stroke is prevention. Follow up with your doctor, get your blood pressure under control, find out your family history, see if you have any medical issues, get your diabetes under control, stop smoking. And if you recognize a stroke, as I said again, call 911, get to the emergency room very quickly, because time is of the essence. And thank you.
Dr. Plummer, as always, we appreciate you. Thank you so much for being with us. Let's go to Dr. Isabell. Dr. Isabell, your closing remarks for this evening.
Thank you. Once again, thank for participating. Regarding briefly Alzheimer's disease, my grandmother, who was a great impact in my life, she had Alzheimer's. I saw how she deteriorate over the years, but she was a very important. Regarding strokes, last thing, embolic strokes, that's where the less common things we know about AFib, but we forget to mention about the valves. For example, if you can get a blood clot in the valves that can go to the brain, and that would be called an embolic stroke. You can get an embolic stroke from infection such as endocarditis, and these are other from infection where you get bacteria in your blood. So that's important. Why sometimes if you see infectious disease doctor, they may put you on IV antibiotics for maybe 6 weeks if it affects the valve, or even IV drug abuse can cause an embolic stroke too. Once again, thank you. Happy to be here.
Dr. Isabell, thank you so much. We appreciate you. We're going to go to 78, Dr. Boykin. Dr. Boykin, your closing remarks for this evening.
Thank you. And thank you everyone for coming out to our webinar this particular month. I just want to leave you with one thing. And I think it would not do my duty if I could not say to you, sickle cell anemia. It's probably a topic we can talk about in and of itself. But I want to say to you, if you have any family member with sickle cell anemia, be engaged, because we know that they're at risk for stroke. They may be at risk for dementia along the way as well, if they live to that good old ripe age of that. But be aware that, although rare, strokes do occur in children. In particular, that children may present just slightly different, but at the same time, they present the same way as adults. So make sure you're taking your children to their general health checkups. Know your family history, and be aware that children may have what's called silent strokes, not so much as TIAs as Dr. Phillips talked about, but they may have sickle cell anemia and have a stroke but without any outward symptoms. So be aware and be engaged. And one last plug I'll say, this is National Cancer Survivors Month. I want to say to you that I'm a 5-year survivor of cancer, and be aware that your family members that may have cancer, and give them good emotional support and uplift. Thank you very much.
Well, bless you, Dr. Boykin. Thank you for that information. Last and certainly not least, the leader of our 2nd District Wellness Committee, the chairman, Dr. Jedan Phillips. Dr. Phillips.
Well, firstly, I want to say salute 78. So happy for you to get to this milestone and to get through it strong. Brother, immediate pass, it's good to have you back. We missed you. Thank you for coming back and getting us in line. To my brothers, again, all of you gave great information, and I thank you for giving of your time in such a substantial way, because I know each of you are incredibly busy and have demands on you in other areas. As I said, been saying throughout our talks each month, prevention costs you a whole lot less than reaction. We have given you a whole lot of steps that can be part of your prevention when it comes to stroke. when it comes to other types of ailments. And it's important for you to take this information and to use it, because if you don't use it, don't be that bruh that I see that had a stroke and then he says, dog, I didn't take my blood pressure medicine. Because a lot of these problems that can happen to us, they are preventable if we do what we have to do. So again, we will be back here next month, last Wednesday of the month. We invite you and any of your friends and family to join, because this information is just not exclusively for members of Omega Psi Phi, but it is for the communities that the members of Omega Psi Phi live in and we serve. So I thank each of you for your attention and coming this evening, and I hope to see you at our future events. Thank you very much.
Thank you so much, Dr. Phillips. Well, what a show indeed. It always is with our phenomenal doctors, our phenomenal supporters, you that join us. And so I just want to take the time to make sure that you subscribe to our 2nd District YouTube channel. Certainly, again, we want to thank our District Representative, Brother Del Rico Gales. He allows us to do this. He allows us to put this on and make sure that the community stay informed with information. Certainly, we want to acknowledge and thank our sound man, our producer, Brother Piercy, behind the scenes, making everything happen. And certainly, last but not least, my takeaways, I want to talk about one word, but I want to talk about it in 3 different ways. I want to talk about the word donation. And I'm not talking about your money. I'm talking about first the National Kidney Foundation. We talk about the importance of kidney awareness, kidney survival. So please check out the website, sign up to be a donor, do your part to help out somebody in need of a kidney. The second donation, the American Red Cross. As you always hear me talk about the importance of donating blood, the importance that has been instituted by our brother, Dr. Charles Drew. We want to make sure that the legacy continues and lives on. So please help save a life, give the gift of blood, and last and certainly not least, donation of bone marrow. My friends, my family, there are people in need of bone marrow donations. And so I ask that you just simply look it up. If you're in good health between the ages of 18 and 40, please take the time, look it up, do the research, and help that brother, help that sister that's in need. Again, my name is Kelvin Ampofo. No past like the immediate past. Thank you to our doctors. Thank you to the friends and family who continue to support us. We'll see you next month. Continue to enjoy your summer, but most importantly, continue to stay safe. God bless.